Hi everyone. Welcome to another Doc Talk. I'm Dr. Logan here at Elevate Sports Performance and Healthcare. Today we're going to go over a case study of a total knee replacement surgery. We are reviewing a patient that I am currently seeing, and I'm just going to take you through briefly what we've been working on, where he started, where we're going, and answer any of the questions that come up from the procedures and the protocol that we have with total knee replacement. So, just to get a little bit of a background patient info, this patient is a 65-year-old male. He's coming in after a right total knee replacement. I'm seeing him about a month out, about 3 to 4 weeks out. He had to be cleared by the surgeon beforehand, so now that he's cleared, we're ready to do some outpatient therapy. Previously, he was a very active individual. He actually competed at the highest levels of competitive sports, so he has a very good conditioning base, a very good fitness base, which is good to work with. He's actually had a history of multiple knee surgeries, multiple arthroscopic cleanups. He's actually had a previous left knee replacement about 20 years ago, so he's already gone through this process. So now we are taking care of the right knee. So pre-surgery conditions, before he was dealing with a lot of limitations in both knees in terms of range of motion, dealing with a lot of pain, especially in the right one that needed the surgery. He wasn't able to complete full workouts due to his pain symptoms, so that was a big limiting thing. And then also it was starting to affect his daily activities, his daily chores, his errands that he was running day to day. So it came to a point where it was time that surgery was the best option for what he was dealing with. So day one, I saw him, like I said, about 3 to 4 weeks after the surgery. He showed a lot of limitation, range of motion, about 90 degrees of flexion. Usually we want about 120 degrees, because that'll allow you to get up and down from chairs relatively comfortably. That's the goal that we want. So limited there. He was limited in his balance. His tolerance turning in bed was very poor. He had a lot of pain twisting and turning and changing positions in bed. The biggest difficulty, the biggest challenge that he had was going up and down stairs. He was dealing with a lot of pain and just a lot of difficulty managing the stairs, especially so that he has some inside his home. He has a set of, I believe, about a dozen. Very guarded in the muscle tone, was dealing with a lot of swelling. You could see a little bit of atrophy, a little bit of muscle wasting of the quads and the calf muscles. You could notice the size difference between the affected right side and then the left side. Like I said, he was dealing with some poor balance, a lot of gait issues. In terms of his walking pattern was off. He was compensating accordingly based on his limitations and avoiding with the pain. And because of that, he was starting to deal with some recent low back pain as well, due to the compensations of movement. So the initial plan, first thing we wanted to do, help with that range of motion, help with the functionality, get it easier for him to move about, getting in and out of bed, getting in and out of the car, in and out of the shower, up and down from the toilet, the couch, and everything in between. So keeping that in mind, getting that range of motion back is going to be most important, along with dealing with the pain and the swelling. If you're dealing with the swelling, that's going to help with the range of motion, and it's going to help with the pain a little bit because there will be less pressure inside overall, making everything less sensitive. There are a lot of, we wanted to also just check in the functional status, making sure that his methods of getting in and out of bed, getting in and out of the car, isn't doing anything to twist and turn on the knee joint that could aggravate it even further. So checking on the mechanics of that was important. Looking at how he was getting up and down from the stairs, that was an important thing too, just to see if maybe there was a method that would be a little bit easier for him, so that, again, it wouldn't be so limiting for him, considering he has to do it every day to get up and down from upstairs and inside his home. So those were the things that we wanted to do. Obviously also work on helping with his overall mechanics, just moving, how he walks, making sure that he's not compensating appropriately, and then that could deal with some overloading issues, and then helping get rid of the swelling and improve that muscle tone, kind of get the muscle bulk back. So that was the initial plan that we've been working on, or that we started with. The progress that we've had since then has been tremendous. Again, like I said, he was a very active individual, so you already start in a good position. We were able to increase the tolerance to weight bearing through progressive loading of weight, slowly but appropriately. We were able to increase his range of motion through manual and assisted range of motion exercises. We have been able to get him to that 120 degrees of flexion in the knee, so we're already there with that. So now it's all about increasing tolerance and strength and weight bearing and movement quality. Doing that with we've improved his ability to control his momentum with body weight movements, reintroducing movements in multiple planes of motion, working on different unstable stances, everything that could be transitional to the real world. Hoping improving his overall re-education of his neuromuscular system is important to improve, like I said, the overall quality of movement, how well he's able to walk, making sure that there's not a massive limp, that he's compensating accordingly or avoiding certain things that have been developed due to habit. So re-educating the muscle and the movement quality is important with that. Helping with reactionary times for safety, just with the uncontrolled environment of the real world. You have to be ready for those things. Terrain changes, things like that, so being used to that. Helping with some soft tissue work, getting his sensation back. He was dealing with a lot of numbness in the knee joint initially, right? New hardware is placed in, they're big incisions, so kind of helping normalize the sensation has been a big issue, and we've been helping with some soft tissue work with that. Again, with the pain and then with the swelling was another way that we can help with the soft tissue and the hands-on treatment. So we're able to get a lot of good changes. We've been going at this for a good 3 to 4 weeks now. The plan going forward, we're going to continue to load the body. We're going to continue to load the tissue to get the density of the tissue stronger, to get his muscles stronger, to get him to be able to control his momentum a little bit easier. Doing that with multi-joint exercises for just general quality of movement is important. We're going to continue to work on the gait training, making sure that the way that he walks is appropriate and he's not going to do any overbearing movements that could hurt anything else, any compensating movements. We're going to continue with leg, hip, back, and core strengthening just for overall strength and fitness. We're going to now then introduce, probably this next week, single leg exercises, unilateral exercises to help with balance and stability of the trunk and the pelvis. We're going to help with balance activities just to help, again, with safety, reactionary times and movements when you're out there in the real world to keep you safe. We're going to continue working on some soft tissue work to help normalize the tone, improve the tissue movement quality, and to help with that scar formation as well. This is also going to help with just the tactile sensation, the skin sensation, and just the overall proprioceptive mechanics, your ability to sense where your limb is in space. That's very important for your brain and body connectivity. And then we're also going to return to just walking mechanics to get you back to overall pain-free exercise, pain-free walking mechanics. Now, one thing to add with the total knee replacement, one limitation is you're going to have to avoid high-impact activities. So it's going to get you to have pain-free exercise again, but we need to avoid anything high impact. So running, unfortunately, is out. Anything quick direction that has a lot of impact force, like tennis, those things are also out. Things that you could do that are appropriate, walking and hiking, but again, everything has to be low impact, no high impact, no quick torsionary forces, because that's going to compensate the knee joint. So, hope that gives you a nice rundown on the protocol for total knee replacement. If you know that you're going to be dealing with knee replacement in the future, please contact Elevate. We'll develop an appropriate strengthening program that's going to manage the pain and arthritic conditions that you're dealing with and help you on your recovery process to get you back to full function, pain-free exercise, and a pain-free movement. All right? So that's all. Thank you so much. Have a great day.